Have you ever wondered if your daydreaming, poor focus, forgetfulness, and disorganization are due to attention deficit hyperactivity disorder? ADHD affects millions of people, but many go undiagnosed. In today's video, we will discuss how to find out if you have ADHD. Hi, my name is Dr. Air. I'm a board-certified lifestyle psychiatrist. Imagine having a TV with 100 channels and a remote control stuck on random. So the TV constantly flips between channels without settling on just one. This is how one of my patients described having ADHD. Attention deficit hyperactivity disorder affects how a person's brain works, making it difficult to focus, sit still, and manage impulses and distractions. People with ADHD often find it hard to concentrate on tasks, may get distracted easily, and might act impulsively without thinking things through. It can impact school, work, and relationships, but with understanding and the right strategies, people with ADHD can learn to manage these challenges and succeed in their goals. Diagnosing ADHD is like tuning a radio. You need to sift through the static of overlapping behaviors and symptoms to find the clear signal that reveals the true pattern of attention and impulse challenges. So how is this condition diagnosed? ADHD screening may involve three processes: evaluation from a mental health provider, questionnaires or rating scales, and psychological tests. Let's talk about the first one, evaluation by a mental health provider. Such a clinician may be a psychiatrist, neurologist, primary care doctor, nurse practitioner, or physician assistant specializing in mental health care. This evaluation involves taking a complete history from you. The goal of this visit is to determine whether you meet the criteria for ADHD. The mental health provider will also want to know if another mental disorder explains your symptoms. This is because conditions like anxiety and depression can also affect your attention and concentration. During the evaluation, you will be asked about your symptoms, when they started, how long they've lasted, and how severe they are. To be diagnosed with ADHD, you need to have several symptoms, not just one or two. These symptoms must have also affected your work, relationships, school, or other important areas of your life. As a quick analogy, picture your thoughts as an orchestra performing a symphony. With ADHD, each instrument separately plays its own tune, creating chaos instead of harmony. The conductor, your focus, struggles to bring the instruments together, leading to a series of beautiful yet unfinished melodies. There is potential for a masterpiece, but the challenge lies in synchronizing the instruments to harmonize the music. This is where the mental health provider comes in, to tease out the various symptoms you're experiencing so proper treatment recommendations can be made. The second process we talked about earlier is using questionnaires and rating scales. These tools are used together with a detailed clinical interview to form a comprehensive assessment. No single rating scale can diagnose ADHD. Instead, it helps clinicians identify behavior patterns that may be indicative of the disorder. Such rating scales include Conners Rating Scales Revised, Vanderbilt ADHD Diagnostic Rating Scale, and Adult ADHD Self-Report Scale. Other scales include the Brown Attention Deficit Disorder Scale, WISE Functional Impairment Rating Scale, and Conners Continuous Performance Test, CPT. The CPT test is a computerized assessment that evaluates an individual's sustained attention, vigilance, and impulsivity. It involves presenting a series of letters and numbers on a computer screen. The participant responds by pressing a key on the computer keyboard for different responses. The CPT test typically lasts about 14 minutes and generates a comprehensive report at the end. It is not a standalone diagnostic tool and should be used with clinical interviews, other rating scales, and a thorough evaluation of the individual. Rating scales in ADHD diagnosis are like calibration tools for precise measurements. They help ensure that the assessment is accurate and that the diagnosis is based on a clear understanding of symptoms. So number 3 is psychological testing. This comprehensive process is designed to assess attention deficits, hyperactivity, and impulsivity accurately. A psychologist conducts this test, which can last for several hours. Typically, it begins with a detailed clinical interview, which helps gather information about your behaviors in various settings, such as home, school, or work. During the psychological evaluation, several rating scales are used to capture the severity of the symptoms. These tools also help to differentiate ADHD from other conditions with overlapping symptoms. Psychological testing for ADHD is not just about identifying the disorder, it is also about understanding your unique challenges to guide effective treatment and support strategies. So, diagnosing ADHD is a multi step process that may combine clinical evaluation, rating scales, and psychological testing. Sometimes a diagnosis may be made following a clinical evaluation with a mental health provider who may or may not use a rating scale. Similarly, you may be diagnosed with ADHD following psychological testing with a psychologist and then referred to a psychiatrist for medication management. No one tool or test diagnoses ADHD. Early diagnosis and treatment are very important though, as they can make all the difference in how you function. Sometimes this difference can be as apparent as someone struggling with bad eyesight putting on glasses for the first time. It clarifies the bloodlines of daily life, helping you and those around you see things more sharply. Proper treatment can produce noticeable improvements in school, work, relationships, and other aspects of life. Many of my patients tell me the difference is like day and night. To learn about ADHD treatment, watch this next video. I'll speak with you soon.